Hello, welcome to New Detroit's Town Hall, Content and Conversations about Race. I am one of the hosts, Marshall Montgomery Favors, Project Manager for New Detroit. New Detroit is a nonprofit organization that works to eliminate racism and create a more just society in metropolitan Detroit. To learn more about our mission and organization, visit us online at newdetroit.org. Today we're going to discuss children, families, and the 2020 school year post George Floyd and amid COVID-19. I'd like to welcome and introduce our moderator, Karen Dumas. Karen is a communications professional and media contributor. She is a frequent guest contributor on Fox 2 and other media outlets. And we are so excited to have her today. Welcome, Karen.
Thank you, Marshall, and thank you, New Detroit, for having me. Welcome to today's discussion, where our topic and our focus, as Marshall indicated, are children, families, and the 2020 school year post George Floyd and amid COVID-19. It's a lot going on. As a community, we are experiencing a lot on top of already existing challenges in our educational space and in society in general. The format for today's discussion is part presentation and part dialogue. I'm going to introduce our guest speakers, who include Dr. Helen Oliver Brooks. She's an early childhood consultant with Wayne Regional Educational Service Agency. Here in Michigan, Dr. Brooks provides support and services to educators, administrators, early childhood providers, and other educational trainers for all of Wayne County. One of the big things that she's preparing for is how educators and children are dealing with trauma during this time and how it relates to the upcoming school year. But first, we'll hear from Gilda Z. Jacobs, who has served as president and CEO of the Michigan League for Public Policy since 2011 and is a current board member of New Detroit, Inc. Gilda is going to begin with a presentation about the issue from a public policy perspective, and will share a kid count profile by county as compiled by the Michigan League for Public Policy. She knows and will share the status of what challenges families and children faced prior to the pandemic and how our current circumstances are amplifying those challenges. And with that, Gilda Z. Jacobs, you can kick us off. Thank you. You're muted, Gilda. There you go.
Okay, there we go. Saying thank you, Karen, for the nice introduction, and thank you to New Detroit for giving me and Dr. Oliver Brooks the opportunity to speak with you about some really, really important things right now. So what I wanted to do was kind of create somewhat of a framework before we start our discussion about schools and equitable education opportunities for kids in Wayne County, and in particular Detroit. I've got a couple of different profiles that it's part of our work at the Michigan League. We're what's considered a kids count organization. We're part of a national network of like-minded organizations all over the country to provide advocates and policymakers and opinion makers the best available data, nonpartisan, so that they can make good decisions for the kids that live in their district or in their school districts or in their communities. We also serve as a resource to the foundation world as well. And the profiles that we're going to go through today are actually found on our website. You can always go in and pull down this information again so that you can have it, and also look at some of the other counties in our state and even nationally, and you can see how we measure up to other communities as well around the United States. So I want to first take a look at Wayne County, and then we can do a little deeper dive into Detroit, because while some of the trends are the same, the numbers are a little alarming and are a little worse, quite honestly. But the nice thing about the way we're doing our kids count presentations right now is we're using a system of red and green, and I even think yellow, that will show where the trends are among certain indicators. And kid count Kids Count takes a lot of different indicators and then presents those in order to get this snapshot. So, you know, in terms of key trends over time, I think it's interesting to note that kids in Wayne County, in terms of the number of kids that are living in poverty, that's actually gotten a little better. However, their older brothers and sisters and the households in general, it actually have more people living in poverty than before. Now, you also need to put a COVID lens on all of this. The numbers that we're looking at are from 2018. So much has happened since 2018, and in particular, we're in the middle of a pandemic where we have unemployment like we haven't seen since the last depression. So these numbers are really way, way worse, not just for kids in Wayne and Detroit, but for kids all over the state of Michigan. So kind of keep that in mind as we go over some of these numbers. So there's a number that I use all the time whenever I talk to groups, and it's all like, it's the free and reduced price lunch numbers, because it really gives you a great benchmark about where kids are. So in Wayne County, we see that the number of kids that are receiving free or reduced lunch are at almost 65%. The Michigan rate is 50%. Both of those are totally unacceptable. I mean, all over the state of Michigan, half the kids that are going to school are food insecure. And it's really, honestly, quite an alarming number. And then to see that close to 15% higher in Wayne County as a whole. Scroll down a little bit, because you can, you know, go through some of these yourself. I don't want to just read the slides, and especially because you know, we have Dr. Oliver Brooks with us, who has had such a great experience with preschool. I think the 3 and 4 year olds in preschool is another very, very important trend to take a look at, because we all know that kids that get high quality preschool are kids that are going to be learning to read by 3rd grade. They have a much greater chance of finishing high school on time and then going on to some post secondary education. And if we take a look at where we're at in Wayne County, we see that the trend, it is trending down, that we have close to 8% less kids that are in preschool. And the Michigan rate is still under 50%, and then it's worse in Wayne County. You know, again, you can see though that our kids are starting to become more proficient in math, and we do have more kids that are graduating on time. And those are trends that are really important and that we want to see to continue. Alex, can you go scroll down a little bit more? So this next area of key trends over time, I think is also very, very important. So, you know, we see that less than adequate prenatal care is an area that still is a problem. We know that infant mortality and maternal death is much higher in communities of color. And so that's why it is so important that moms get prenatal care. So while prenatal care is down, the good thing is we are starting to have better numbers when it goes to infant mortality. For a long time, Detroit led these numbers in terms of infant mortality. We're still not where we need to be by any means at all. It's a real problem for moms that are of color. We're making some changes, but we still have a long way to go. Good news is, you know, more kids have health insurance. We can discuss later Medicaid, because it's really been very helpful. Alex, you want to keep moving down? Great. So another area that we've done extremely well in is reducing the number of births to teenagers. It's been an initiative that's been going on in our state for quite a while, and it's really paying off. interesting thing is looking at kids that are in investigated families for child abuse. Those numbers are not so good, and perhaps Dr. Oliver Brooks may be addressing this in terms of trauma with COVID, but we're now starting to see a bad uptick of those numbers with people home and not working. And then in the next section, additional data, children with internet at home. The kids in Wayne County are really disadvantaged. Next to other kids in Michigan, close to 88% of kids in Michigan have internet. In Wayne, it is about 79%. So you got like 20% of the kids. That's a lot of kids who don't have that opportunity. So what we want to do now is switch over to Detroit, take a look at those numbers. So we're going to pull up the data snapshot for Detroit. And yep, there we go. The trends are almost identical, but the numbers are honestly worse. And, you know, we don't want to be Debbie Downer about this, but it's really important to look at what the data say, because that's how we need to be addressing the problems that exist in our neighborhoods and in our communities. So it's really important to take a look at these numbers. So, you know, in that first slide, I talked about the number of kids that are receiving free or reduced lunch, and that in Wayne it was I think I said 67%. In Detroit, you've got 88% of the kids. So think of the high poverty levels that you have. Think of the number of kids who are food insecure. You know, my food is so important if we're going to fuel our kids' brains so that they can do well in school. We have to change those numbers. And a lot of kids get their meals, the only meals that they're eating at school. So when schools are closed, that creates a problem for not only their nutrition, but fueling their brains so that they can do well. Alex, you want to scroll down a bit? I do want to mention, you'll see the failings of the high cost of housing, which I think is very important right now. It's at about 42%. Again, with COVID, you have people who can't pay their rent because they're out of a job or pay their mortgage payments. So that's something else that really needs to be addressed as well. I'm going to scroll down a bit more, Alex. Oh, kids in 3 and 4-year-old kids in preschool. I spoke before about how important this is. We're seeing a downtick as opposed to an uptick in the number of those kids able to access high quality programs at all, let alone high quality programs. And then the number of 3rd graders that are proficient in English and language arts is down as well, but we are starting to do better in terms of math. And there's been a big push in Detroit to get kids to graduate on time, and we're starting to see all of those efforts pay off as well. I scroll down a little bit more, I think. Okay, we talked a bit before about adequate prenatal care, infant mortality. Infant mortality, unfortunately, is still a problem in Detroit. Actually, the league did a really good comprehensive report that people can go to about infant mortality and maternal health, and with some of the recommendations and how we can address that. But this is a trajectory that we really have to change. Again, good news is lots of kids have health insurance. So we're really happy about that. Just Kit mentions a 2-generational approach. I just want to put in a little plug for that. That is sort of a policy recommendation that we make for almost everything in the budget. You can't help parents without helping their kids, and you can't help kids without helping their parents. It doesn't work. And a lot of kids are living with grandparents, so there needs to really be an intergenerational approach to how we create policy for our state. Again, in Detroit as well as Wayne County, we saw that the number of teen births is down, so we're very happy about that. Kids without internet in their homes, I want to point that out because we're going to be going to virtual learning for probably a long time over the upcoming months, and we're seeing that there's this huge gap of the kids that are in Detroit compared to the rest of the state. Fortunately, there have been some corporations and companies and foundations that are stepping up to try to close that gap, but we have to make sure that that gap gets closed and fast so that kids can start learning virtually if that is the way their schools are going to be teaching. And I think that brings us to the end. Yes? Yep. Okay. Happy to take any questions on these statistics. And again, our viewing audience can go in and get this information themselves from our website, which is www.mlpp.org.
Well, thank you. I want to say thank you for that data, but it's rather depressing to be honest. And so I'm going to look to Dr. Oliver Brooks to try to put that in some, kind of humanize that data in terms of what that means for not just Wayne County residents, but especially Detroit residents when they're burdened with such social challenges, no internet, infant mortality. Yes, we do have access or increased access to health insurance, but are they accessing, medical care in order to circumvent that? So can you humanize those statistics for us, Dr. Oliver Brooks? Unmute yourself first. Unmute yourself.
Okay. Ms. Loomis, and thank you, Ms. Jacobs. That was amazing. And I'm sitting here quickly jotting notes down, looking at the numbers. And I think that we have to start with some of the issues that they are being faced with. I wrote down when you said COVID lens. And I think that a lot of the challenges that we've been experiencing were prior to COVID, were pre-COVID-19. But a lot of it now has gotten worse because of that. One of the things that many of our families, especially the adults, are experiencing or starting to acknowledge is the trauma that we are facing. And I say we because everyone who's living through this pandemic of COVID-19 are experiencing some sort of trauma. Trauma being deeply distressing and disturbing experience. And I don't know how you could explain this pandemic otherwise. One of the things that we have to look at as we think about the challenges that the children are facing is the challenges the adults are facing. We can't begin to address what the children's needs are until we address what the adult needs are. One of the news reporters was explaining about domestic violence and how it has increased because now we're being forced to be in the environments with the abuser. There's nowhere for you to run, you're there in the home with them. The children are there in the home with them. And this is not just families in poverty. These are families who've been experiencing these challenges, but were able to leave home to at least escape some of the challenges, but now you have to face them head on. In order to be able to support children, adults have to feel safe. As we look at going back into the classroom, you think, now how are the adults going to address the children if they're having some of these experiences of domestic violence, of child abuse and neglect? Sometimes we don't really, and the triggers we react to the triggers, and those are additional consequences of being on lockdown. We do have poverty. We had poverty before COVID-19, but now it has increased because of the jobless rate. We have more families unemployed, more families having struggles just trying to get the unemployment benefits. Homelessness, everyone was safe when the governor said no eviction. So we were safe for a moment. But then once that was lifted, all of a sudden the landlords want all that, the back rent as well, not just current. And you couldn't save the back rent because you didn't have it. So that's created additional stress in the home, not just for the adults, but for the children. When we look at interneting technology, that's the biggest piece for us, because some of the children were already behind going to school, and now they're home. They don't have not only internet, they don't have the technology materials to even access internet. So they don't have tablets or laptops or a way to even access the materials. We have students who English as a second language, who's now supporting those children, and the incarcerated parent. When we look at, these are all eligibility factors for preschool students. When I hear the numbers for preschool has gone down, we're looking at where are the children? These are all factors that impact children going to school. And the biggest piece is death by COVID. The adults have been traumatized by losing so many family members, many elderly, some not, to COVID, and having to grieve without being able to say goodbye. That is just so critical, being able to have closure when you have a death, but not being able to go through that process makes that difficult for, again, not just children, but for adults as well. Yes.
And so for parents and educators and maybe even some students, some, young people that are watching this, where do we go from here? I mean, because at a certain point, as you indicated, we've been dealing with these issues for the longest, which I think is almost inexcusable. I mean, it really is. We have 77,000, count them, nonprofit organizations in the state of Michigan, the majority of which are located or focused on issues to address in the city of Detroit. Why are we still having the conversation? Why are we still trying to solve problems that it almost appears that we somehow perpetuate? Either of you can, or both of you can weigh in.
I think that's, we don't, there once upon a time was a saying in the African-American community is what happens in this house stays in this house. Mm-hmm. Often reach out for the support for fear of being judged by someone that I might need to seek some additional help outside the home. So sometimes it's because they don't know. Sometimes it's because they don't want others to know. And they risk many challenges, even what it's doing to the children, to avoid being found out. Yes, the resources are there, and many of our families can tell you what the resources are and how to get them, but choose not to access those.
And so from a former legislator's lens, I can tell you that there has been the systematic dismantling of our safety net system over many, many years. We've put a cap on the number of months and weeks you can receive benefits. We reduced the number of weeks that you can get unemployment insurance. We have, until recently, had an asset test on food assistance. There is a ban on receiving food assistance if you have 2 drug felonies, and even though you've already paid your time and you're out and want to start your life again. We have some very, very bad policies that don't help people have greater opportunities, that actually create more barriers for success. And we really need to take a look at what those are. State government should not be creating barriers. State government should be reducing barriers to help people have the opportunities to feed their family and work and take care of themselves. So, I think we really need to take a look at what those policies are. And then on top of it, we also have in the legislature what I call Detroit fatigue, Flint fatigue. There are legislators who are saying, I don't want to send any more money to Detroit. What about my backyard? What about the people in my district? But they're often not making the connection. They're also often not connecting those dots that, you lift all boats when you help people have better schools and increase the number of dollars that go into school districts, where you help people have access to food. It helps everybody. But for some reason, there is this thinking that if you do something to improve the safety net, it's not going to help the people in your district. And I am for years just been flummoxed that, by that thinking, because it's just not true.
Which will take me to Dr. Oliver Brooks, the discussion or the injection of race. We're talking post Floyd murder, Mr. Floyd's murder, but we just saw another incident yesterday in Wisconsin. So that hasn't changed. There is increased racial tensions. Some people will say that, those cities that are out state or in the western part of Michigan or northern Michigan are not concerned about supporting Detroit because Detroit is a predominantly African-American city. Dr. Oliver Brooks, with the increased attention to racial injustice and disparities, let's talk a little bit about that added layer of pressure, if you will, or tension, stress, or now we've got a whole nother social burden to bear.
Well, that's one of the challenges when we speak about the lack of technology in the classroom. That was major, and that's one of the challenges that they are experiencing. Experiencing in Wayne County, not just in Detroit, is that the lack of technology and the lack of access to the internet. When you look at the fact that the children don't have, but the expectations are the same. When we went to remote learning, the expectation is everybody has access to internet and everyone has access to the technology, which was not true. And a lot of the families fell even further behind. Those children were already behind. And it speaks to the disparity in terms of the educational lens, what the children have access to and what they do not have access to. The expectations were the students were going to keep up, the parents were going to become the teachers and continue to teach the same lessons that the bachelor degree teachers were doing in the classroom. What has occurred is the opposite. Our children have fallen even further behind because the parents aren't able to keep up with the lessons. The children don't have access to the technology. And now they're even complaining about sending the children back into school to get support from the degreed professional. So yes, it is making a difference in terms of race, access to resources for the families, because the families who have the resources are going beyond what's being offered in the classroom and making other arrangements. I heard about pods. They're bringing in tutors. Our students don't have those resources, but one of the things that we are looking at, I support the Great Start Readiness program in Wayne County, and many of our administrators are looking at how do we resolve that challenge, and technology has been the priority in terms of purchasing those materials for the students to have at home so they do have access to that same information.
But does it go back to what you said prior, that the resources are available, but making sure or connecting or getting people engaged or interested or energized enough to use those resources is what's going to make a difference. So there's still a disconnect there. If you make the resources available, getting the families to utilize those resources is another challenge.
That is a challenge. And right now, as we look at opening in September, getting the materials to the families, what we're experiencing is families are not registering for pre-K right now. All of the numbers are low. So then we have to ask ourselves, why are the numbers low? Well, it's the fear of, is it too soon to go back? What's going to happen? I think I'll keep mine home. What's going to happen next? All we can do is provide the resource. They're purchasing computers for the preschoolers. They're making certain they have access to the internet. And now we somehow have to get the families to buy into supporting the children at home. It has to become a priority. Education must become a priority.
Gilda, would you like to weigh in on that at all?
So when we talk about education, we have to, I think also talk about equitable funding. And we have a system that is based on proposal A. It doesn't work any longer. We don't have equitable funding. We know that there needs to be, I was part of the school finance reform collaborative. And speaking of preschoolers, my 3.5-year-old is ringing the doorbell. I will be right back. Okay.
Oh, really? Okay, that's fine.
I will be right back because they don't know that I'm on this call. So.
That's no problem. Go right ahead, and we'll continue the conversation. But Dr. Oliver Brooks, I mean, and I don't mean to sound like a naysayer, but the conversations continue. The resources continue. We continue to pile on the resources, but there almost seems to be some structural intention to this cycle, because now we're going to have a generation of kids that are even more ill prepared than they were prior. What does that mean looking down the road and for generations ahead?
Well, again, we have to get the parents to buy in. And oftentimes one of our challenges now, our children are brought to school late and they're picked up early. Well, if the school day starts at 8:30 and students get out at 3:30, why are you bringing them at 9 and picking them up at 2:30?
Has anybody ever asked any of those parents why?
Oh, yeah, yes.
Okay.
I have been present when they've asked them, and we've gotten responses such as, well, I'm in the neighborhood, or I have to pick up my youngest early because I have to go to the elementary school to get the older child. It's convenient for me now. The rationale they're using means they're not making this a priority. See, there can be consistently complaining about what's provided, but until you buy into this piece and actually start making sure your child's at school every day, making sure the child's on time, picking the child up at dismissal time, not early because it's convenient for you, and finding out what other resources are available to you. What are the children getting? And that's a conversation educators are having frequently, explaining to the parents why the child needs to be present, what the children are gaining by being present, and the importance of being on time and picking up on time and not early, because we're setting the foundation now for these 3- and 4-year-olds. They're learning now that it's not acceptable to show up late and to leave early. But one of the things we have to also remember is children with adverse childhood experiences become adults with adverse childhood experiences, and they haven't dealt with those challenges, and they just continue, and it does become generational.
So Gilda, you want to either continue or pick up on this in terms of maybe redirecting some of the efforts that we do to raise the consciousness and engagement?
Well, I want to go back to equitable funding for just 1 second, because
Please.
I think it's very, very important in this conversation. So I was starting to say I was part of the school finance reform collaborative. And the report basically said we need just under $10,000 per kid in Michigan, just as a bare threshold to give them the education that they need to be successful. But then we know that kids that have special needs, we know that kids who were English, is their second language, and we know kids that live in high poverty areas need more resources. They do. Money really does matter. And although we have sort of at-risk funding formula, it's really not the same as a true weighted formula. So we really need to go back and change our budgeting in order to provide the adequate resources we need. It's a matter of pay now or pay later. And we end up having kids ending up later on, in the part of the special ed system that maybe didn't even need to be in the special ed system because they didn't have that adequate help right up front. And so I just think that, as we go down this sort of policy road, that we really have to understand that a weighted formula really is very, very important. And it's the same for rural areas, for rural poverty, it's not just an urban way to fund education. So I just have to put my plug in for how we change our priorities in the state. And at the end of the day, we're talking about priorities. How do we make sure that these kids who are going to be our next librarians and doctors and caregivers and dental hygienists and plumbers and carpenters are going to get what they need to be successful. There's lots of ways to be successful, but we have to be really making an investment.
So who should we be talking to? Who should we be pushing? Whenever we talk to anybody, everybody has the answer for what should happen, and yet everybody fails to implement a solution. Who should be championing this effort, and why aren't they?
Well, you would think the legislature would be doing this, and I'm not sure why they're not, because they're often grandparents and parents, and they've certainly been kids, and they've been through the system. So, I think that the voice of the voters has to be heard loud and strong. We need way more people to be engaging at the community level and being in close contact with the people that are running for office, so they know what their agenda should be, and then their legislators, because people want to get reelected. Well, you're not going to get reelected unless you're doing what your constituents want. And there's a lot of power in the vote. And I think sometimes people feel powerless in this process. So we have to empower people and let them know, you really can make a difference by using your voice. So that's where I'm coming from.
and Dr. Oliver Brooks, when we talk about a lack of prioritization, we are probably talking social apathy, political apathy. People are tired, they're dealing with COVID, they're dealing with all types of, everything. Do they even have the wherewithal or the fortitude to give thought to their legislative representatives and what they have to do to hold them accountable or have a formidable ask?
I think that we can't leave the parents out. The parents have to advocate for their children. The legislators are making decisions and laws that affect the families, but it's the parents who know what their children need, and they have to be those allies. They have to get out there and they have to fight for what the children deserve. And that requires parents being actively involved in what's going on in the schools. It's not the sitting at home and waiting for the letters to arrive or the phone calls or the complaints. But if you're there, then you know what's going on in that building.
But let's weigh in some of the social challenges that I've heard educators talk about, because now teachers are educators, they're social workers, they're nurses, they're psychologists, they're everything. Because not every parent is just sitting at home waiting. Some parents are working, one or two jobs, or they're at home trying to figure out how they're going to get another job. There are the social implications that prevent parents from actively even learning how to be involved. How do we incorporate without being burdened by those social issues that continue to be a burden for parents, ultimately kids and educators in the school system?
Well, I didn't imply that the parents are not working and that they are just sitting home all day. I'm saying that even though working parents still have to be actively involved in the school and in their child's education, knowing what's going on and what's impacting their children. And again, they are their strongest ally. Yes, parents also have, many of them have multiple jobs or employment, and they are responsible for shelter and food and whatever the child's needs are. But again, when you are involved, you know what's going on, and you have to advocate for your child in spite of all of the other social issues that are impacting your life. Being homeless, I've spoken with the homeless liaisons, and they've gone into shelters to provide technology. So again, if the parents are advocating for the children, I know that they can't do everything, but you can do something. And you have to start someplace with making certain that your child's needs are being met.
And I sometimes wonder if parents, feel powerless, and that they can't. Do they know just how much influence and impact that they have and can have by speaking up, by being involved? I know my kids, their school, they thought I worked there. I was there, all the time, anytime, on both sides, just to make sure that I was supporting, the effort, as a small private school, but also making sure that, I knew what was going on with my child. But, how do we remind, teach, or instill that voice or trigger that voice inside of parents and a community? I remember when test scores came out, this was under Jennifer Granholm, and she said if this were happening anyplace else, they would storm the Bastille, because everybody was quiet. Failure and mediocrity have become normalized in certain areas. What do we do as a community, whether we have children in school or not? Like you said, Gilda, it's pay now or pay later. How do we rally the community behind such an effort so that it is beneficial to everyone?
Well, that's one of the things with the GSRP program, is that they have monthly meetings so that information is shared with the parents about what they can do, what's going on in the schools, and how they can best support.
It's interesting. I think when you think about how many parents have more than one job, they're maybe taking their bus to work. Their days are packed. A lot of single moms that are trying to balance everything. And it makes me think back, in my very first life, I was a special education teacher in the Madison School District when I was first out of college. And I have to, when I think about the advice that I gave some of my parents, that was so not realistic in terms of my not understanding what was really going on in those homes. And, I think things are starting to change where teachers and the administration are understanding so many of the things that you were talking about, Dr. Oliver Brooks, about what's actually going on in homes, so that not to give parents or families excuses for not doing something, but to help them remanage a little bit, some of the stresses that they're feeling so that there can be success. So it goes back to, so many of, even implicit bias training that, that parents, or that teachers might have to have if they're not a teacher of color and they're teaching kids that are African-American or, brown or black kids. There's so many different parts of this that I think are important to have those successful experiences. So anyways, I kind of wish I could take back some of the advice that I gave parents years ago in terms of not understanding what was going on. And I'm so glad that we have people that are understanding the day-to-day traumas that families have just trying to exist every single day, because life is really hard, especially during COVID.
With all the attention, we've got we've got protests. We see multicultural groups of people rallying for Black Lives Matter and other social issues. Are you hopeful that there can be something positive that comes out of this for our community at large? And if so, what is it?
So, well, I'm so happy that the governor, has come out to say that we have a public health crisis, that's racist, and that and it's just one step, but having implicit bias training for people that are in the medical world, just a small, tiny thing to try to, taking one bite of the elephant, one bite at a time. But I think that people are kind of waking up to kind of what's happening and trying to, for me as a white leader of a policy organization, trying to change kind of how I do my work and my expectations and my lens, but it's not impossible, but it's a lot of work. And I do believe that there are a lot of people who really now want to make those kinds of changes, but it's super intentional. It just doesn't happen.
Dr. Oliver Brooks?
I think that the positive to come out of this is that people are being made aware and changes are occurring, whereas things are no longer being swept under the rug. And the privilege is being acknowledged, and confronting racism is actually starting to happen, and it is starting to be addressed. And as a result, people's attitudes, the way you interact, the way you talk to others is absolutely starting to change. And things that once were just accepted because of the person that was stating it is no longer being accepted.
So ladies, let me ask you each, which do you think makes a bigger difference? Because I think policy is great, but I think it all boils down to practice and the application of any law, rule, or regulation. Give me your take on policy versus practice of, any changes that may come about, any laws, any rules, regulations, or guidelines that, are from funding to educational or resource support. I mean, give me your perspective on policy versus practice.
Well, I'll go first.
Okay.
Data should inform decisions. Okay, I mean, I think that we need to be data driven and take a look at metrics as we make decisions. I just think that otherwise you have personal philosophies that are controlling policy, and that's not how good policy is created. But I think most importantly, it is that community engagement. It is that community voice. It is going in and asking the people who are actually being affected by the policy, what's going to work for you? It's so easy for somebody to come in and, use whatever lens they have to say, this is what you ought to be doing, if it's not going to really work in that community and be individualized. So, for me, the heart of good policy is finding out from the people that are affected, what's going to make a difference for you and for your family and for your life.
And I think practice. Actually, practice is what leads you to mastery. So once the policy is there and we start practicing or implementing change, then you start to see where change actually sticks. Ongoing practice.
Well, and I appreciate that. And Gilda, I just did a conference for the Chicago State Foundation, and someone was participating in the philanthropic space. And they said the same thing, that too often people that administer funds are disconnected from the people those from your desk and know, or at least try to connect with the people that you're working to help. I mean, that makes all the difference in the world. And I solely agree with you too, Dr. Brooks, that I do believe no matter what kind of rule book you have, it's the person that's executing those decisions that'll, determine the ultimate impact of that policy and that practice. I know we've talked about a lot of kind of depressing numbers, and it kind of feels overwhelming. And I think it's overwhelming for people in general. We turn on the news, it's politics, it's COVID, it's a protest. We don't know whether or not we're going back to school or not. Let's try to leave on a high note. Let's talk about a few things that individuals can do as parents, as educators, and what we can do as a community that can help our parents, our educators, our students feel not just more aware, but more engaged and safer. I know that sounds like a lot, but I kind of feel like the answer is probably a lot more simpler than it sounds. But what can we leave our viewers with that gives them some degree of hope and a call to action?
I say, don't be afraid to communicate. Call the teachers. They want to connect with you. Reach out to the teachers for support, and you can only support your children the best you can, and that's all you can do.
Okay. Can't hear you, Gilda. You're muted. You gotta open your mic. We're gonna have you tech savvy by the time this is all over. It's okay, open your mic, take yourself off mute. Nope, turn your mic on. Oh, she's gone. Okay, well, we lost her. Well, I guess with her departure, unexpected departure, I do want to thank Gilda Jacobs for her contribution. Again, she shared some data from Kids Count and websites where you can go and get the data, because data does matter. We do have to understand the magnitude of the challenges that we're working towards before we can actually allocate those resources toward them. Also want to thank Dr. Helen Oliver Brooks for your insight. We certainly appreciate your contribution, but I really think that we can make a difference. And I do think that one-on-one connectivity, Gilda said that she wished she could take back some of the advice that she gave. Oh, there she is, you're back. That she gave some of.
I don't know, I disappeared and I couldn't see you.
I do want to go back and let you answer that last question though. We're gonna have you tech savvy before this is all over too, so go ahead.
Question?
I was asking to leave, give some guidance or call to action so people can leave with some degree of hope.
Yeah, so first of all, I wouldn't be in this space for close to 40 years if I didn't believe that there is hope and that people are basically good and really want to make change. So I think it's important to engage, particularly at your community level. Talk to the people on your school board, even if you can't get to a meeting. It's really important to be engaged. But I know it's tough. I know it's hard to find the time to do this when you are balancing so much, and to give yourself grace, during this time. But that one's voice really does make a difference in this political world. It really and truly does. And that people should remember that their voice really does count. And I think so oftentimes people feel, my vote doesn't count, my voice doesn't count. It really and truly does. Legislators really do listen if you pick up the phone or write an email. So, and
not just around election time. Hold them accountable for their entire.
Or around election time. And it's the best time, honestly, to engage with people. But I think we need to hold our elected officials accountable. We need to hold our community leaders accountable. But it's really easy to point fingers and blame people. But if you really want change, you've got to be part of the change. And I think the movement that we're starting to see across the country is really important. There's lots of different movements that are going, but people's voices are being heard and being listened to.
Well, I want to throw my 2 cents in the ring. We talked about prioritization. I think, if we prioritize our children, we've got to prioritize them all the time. It's not just out of convenience. And we also have to embrace our children, whether we've given birth to them or not. So, if we see them and they need help, they need a kind word, we need to extend to them in that capacity as well. You both have been amazing. I certainly enjoyed the conversation. I had to catch myself because I was listening so much. I'm like, wait, I'm supposed to be asking them questions. I do think that it is helpful. Data certainly makes a difference, and certainly knowing how to apply that data, as Dr. Oliver Brooks shared, and the impact that that has on a community makes all the difference in the world. I want to thank you both, Ms. Jacobs and Dr. Brooks, for your time, for your insight, certainly your expertise and your commitment. I think that makes a difference as well. I also want to thank New Detroit for their commitment to a more just society and for hosting these much needed conversations. For more information, I invite you to visit newdetroit.org and to stay tuned for the next conversation and town hall meeting that will be hosted soon. Thank you for joining us today.
Yeah.